Good evening, ladies and gentlemen, and thank you for coming for this opening session of the 2015-2016 Health Forum. If this is your first time, please feel warmly welcomed. We're happy to have you here, and any questions we can answer about the forum and future programs, we're happy to do. If you're returning from last year, we hope you had a good summer. These health programs are actually held here once a month through the year. There will be 8 programs, and I have the pleasure of being able to talk and not have to do any of the work. There are considerable work in putting these on, and there are 2 people, Tamar Karabian, who is here, who puts on the programs. And Eric Wilkes, who keeps track of the data and the information about who signed up and getting, so that if you're not getting things sent to you directly, Eric is the person. We couldn't do it without them, and we have a wonderful year ahead for you. Let me just mention a little bit. These programs are held on a monthly basis. There will be 8 through the year. 3 programs in September, October, and November, 5 more after the first of the year. Programs are put together on the basis of suggestions from you, the people who are attending these sessions, and from an advisory group who takes your suggestions seriously. So at any time, if you have suggestions about program, conduct, content, things of that kind, please let us know one way or another, because it really is a forum in which you are as much a part of the dialogue as our speakers are. So please feel that you're part owners of this process. In this month, October and November, the 3 programs will be, as you'll hear today. In October, the program has to do with the growing size of healthcare organizations through mergers and acquisitions, and the reduction of the numbers of players as they get bigger. It should be a very interesting program. Tony Schiff has been putting that together for us. Tony is here somewhere. The program in November will be dealing with changes in the Medicaid program. Medicaid, as you may know, is now the largest single insurance provider in the country. It's the largest single, and it is changing from being the poor people's program to being some series of quite other things and very interesting. For the next year, in 2016, some of the subjects will have to do with first of all, a review of efforts at cost containment, what has worked and what has not. Key issues in providing health care to children and how they are affected by health care reform. There'll be a session on the rise of the field of genetics and how it is changing the practice of clinical medicine, clinical care, and how we all have to be aware of the impact of genetic makeups in all kinds of things. There will be a session on the price and availability of cancer drugs. Since it's the 50th anniversary of the Medicare program, we'll probably have a program reviewing the history of Medicare as on its 50th anniversary. We recently have had a suggestion that there should be a program on healthcare transformation taking place in China, and we are thinking about actually having that program next year as we get more together. The idea is that these programs are hopefully interesting to you, and we appreciate your ideas and suggestions. My pleasure today, that's about all the talking I'm going to do, except is to welcome you, and you're part owners of this with us. So you're not guests, you're now part owners, and please feel like owners. Particularly with Tamar and Eric, you know, they'll respond to you better than I will probably. It's a great pleasure of mine to introduce our speaker today, but also to honor him, and that is Tom Gordon, the Senior Vice President for Medical Affairs, a proper title, I'm not exactly, at Cedars-Sinai Health System. Tom has been in charge of the Cedars-Sinai Medical Network, the Medical Care Foundation, the medical group, and just about everything medical at Cedars, and other things as well. If you know Tom, he has a way of getting involved in a wide range of things, including how your dog and your children are doing and other sorts, which is a nice kind of. But most important for us here at UCLA, and the reason why we are honoring today as the guest of honor for this first session, is that he's such a good friend of the School of Public Health and has been for so long a time. Tom is a person who has given to us for 20 years now, Tom, in helping students, jobs, placement, advice, training, all kinds of things. Close friend, close colleague, and I'd like you to join me in giving Tom a round of applause in honor of being the guest of honor today. Tom. Let me stop there and say you're welcome again, and let me turn it over to Tom so he can get some work done as moderator of our session today.
Thank you. Good evening, everybody. Thank you for being here. We got a good crowd tonight, and I'm grateful to be a part of all of this. So when my dear friend, Dr. Paul Torrence and Tamar called me several months ago, and they said, we're going to have our first healthcare forum of the year, and are you interested in possibly moderating or being a speaker? Years ago, I would have gone speaker. Now I'm moderating. I figured out it was a much better way to go, and it's a subject I happen to love deeply. Before we start, I do want to tell you that we are live streaming today, so you will all be lively streamed the entire evening. So be careful what you say. It will be held against you later. And the next forum, as Dr. Torrence mentioned, is going to be on the 28th of October. Our old friend Tony Schiff is going to be the moderator. Tony Schiff is a healthcare lawyer, someone we've known for a long time and done a lot of work with over the years. He's going to have Anthony Wright, the executive director of the Health Access of California, and John Wiegand from the Federal Trade Commission, and Dr. Jack Resnick, who's a member of the Board of Trustees of the AMA. So every program here has been worthwhile, and I hope you all come to many of them. So what I'd like to do is just tell you a little bit about what my three dear friends and colleagues and panelists and I do for a living, because everyone always says, I don't understand, you oversee a medical care foundation. I don't know what that means. Do you hire doctors? Do you work with doctors? Are you a doctor? So I found a very short video that explains what my colleagues, the panelists, and I do that I'd like to share with you. Could we cut the lights, please?
This guy right here is my great-grandfather. He's the first cat herder in our family. It's easy. Only together 10,000 half wild short hairs. That's another thing altogether. Being a cat herder is probably about the toughest thing I think I've ever done. This one's man right here. If you look at his face, it is ripped to shreds, you know? I wouldn't do nothing else.
It ain't an easy job, but when you bring a herd into town and take lost to one of them, ain't feeling like it.
So the truth of the matter is, while it isn't easy, there is nothing like it. I've been working with the Cedars-Sinai Medical Group, which used to be the old Medical Group of Beverly Hills, for 27 and a half years. I've never looked back, and I've never regretted a day of it. And we've been very, very lucky to build it into a real premier health system. I just brought this along to give you a 2-second overview of what we look like. So on December 31st, 1993, we sold the old Medical Group of Beverly Hills to Cedars-Sinai, and Tom Prislak, who's my wonderful boss, immediately mentioned that we are now a health system. And it was a new word at the time. It is an integrated delivery model of hospitals and doctors working together. And hospitals and doctors are not shoes and socks. They're fighting for the same dollar. They don't agree on everything. And this was amongst the first of its kind. I will tell you there were 25 of these foundation models established back in 1993, and 18 of them didn't make it. They couldn't agree. They couldn't figure out a way to share the dollar to make it all work. And with Tom Prislek and the Cedars-Sinai board standing at my side and our doctors believing in us, we made it. We're one of the older systems out there. So he ordained that we would be broken into 3 businesses: a hospital, a medical delivery network, or a foundation, and teaching and research. With the help of some amazing docs that I work with, and a supportive board, and Tom Prislek, and an amazing management team, we have added on all of these groups, and we are now a $350 million piece of Cedars-Sinai with 300 employed physicians and 754 docs in our IPA. The cat herding tape is the best explanation I have for what I do, but I'm having a great, great time. We also have our own billing company. We have 250 people in a separate location in Torrence, and it's been one heck of a run. So how did I meet Paul Torrence? So it's only fair both ways, Paul. So, so about 20 years ago, somebody introduced me to him, and he's probably the most well-regarded and distinguished professors in this entire university. And I've had the privilege of being the MC at the gala for the School of Public Health over the last many years. And I mentioned Paul's name, and 500, 600, 700 people come to their feet. He cares about every student that ever went to this university, in his school or not, and he guides them and he mentors them. And he set up a program, a preceptor program, many years ago, where the students in between their first and second year in the School of Public Health and getting their master's had to find a job in healthcare. And we met, and he asked me if I would be a preceptor. So you come to a preceptor evening, you meet all these wonderful students. Paul is introducing everyone to everyone. He's supporting and cheering for everybody in that room. And I'm in the room as a preceptor with people like Blue Cross and Kaiser and all the other major organizations in town. And we meet these wonderful students. They spend the summer with us. And I have to tell you, I've had 18 students over the last years, and 17 of them still work at Cedars-Sinai. So the program has been a blessing for me as well. So thank you, Paul. You've made a great difference. Now back to the program. So people ask me about what makes up Cedars-Sinai, what makes up this medical care foundation that has existed long enough where all but 2 of the original partners are still there, and it is our culture. It's the only secret sauce we have. It's not brains, it's not anything else, but making sure that quality and how we treat one another and how we treat our patients is the number 1 and number 2 item on the agenda. I would love to show you our first photo, but it's just a heck of a change and a heck of a difference and a lot of growth. So I found this years ago when Hillary was trying to lead healthcare. And they showed it to me, and I was lucky enough to go to Washington and meet with several of our senators and talk about how does this work, because this looks like a Skinner box without cheese. But that was healthcare reform as she designed it many years ago. Obviously, this was never passed. We have something today that looks a little bit different. Looks like that. Now, this has a lot of problems. This is an actual chart from Washington. I'm not smart enough to have made this up. There are several major problems with this chart. One of them is if you look in the bottom right-hand corner, second from the right, it says patients. They're supposed to be up there in the middle. And that's something that they are still working to understand. But this is a box that my colleagues and I have to jump through all the time. Because healthcare is a changing industry. It is the second most highly regulated industry on the planet behind nuclear weapons. What you people do for a living is regulated just behind nuclear weapons. So I take my hat off to all of you. So my colleague, Dr. Weingarten, and I had a similar set of slides. And it just talks about, this is really talking about change. These are all companies that many years ago, if you would have told me they did not exist anymore, I would have had you committed. There is no way on God's green earth these companies wouldn't exist. They were the giants. They were the people we looked up to. They were people we learned from. We built models on. Kodak, they missed digital? I don't understand. So healthcare, as it goes through the change we're about to go through, cannot afford to miss anything because we're taking care of human lives. Twinkies came back, though. I'm very excited about that. So instead of being afraid to change, my colleagues and I spend a lot of time working with our hospital and working with our doctors and telling them that change is good. Scary? Yes. Tom Prisolak says all the time, he has a friend who says, I am not afraid of change, but you go first. Because the reality is we are all afraid of change. We work very, very hard with our docs and very closely with our docs, literally one-on-one as necessary, to bring this change about, to give them every tool necessary to not be afraid of where healthcare is going. So everything is changing, okay? One ailment per visit. Doctors say to me all the time, they came in for this and they had 2 things and I only have 15 or 20 minutes. Our job is to say yes. Our job is to say yes. Our job is to take care of people, and I'd rather you run late and we all do the right thing. But we've added a few other things for the doctors to work on. Open notes, patient engagement, EMR. Tomorrow is ICD-10. Tomorrow, ICD-10. I will not be in the office tomorrow, okay? Because I don't want to hear what's going to happen tomorrow, but it's again another change. And it's something we have to get our docs to halfway enjoy and give them every tool necessary to accomplish all of these very things. So now we've gone from volume-driven healthcare to value-driven healthcare. It's just a slight word. I believe in words. I think words mean everything. I think it's a nuance, and my colleagues who will be up here in a moment will explain this much better than I am able to. So the overview is we have to change. There is no option. My father used to say that if you're at a train station and one train goes by a day and it's going east, you have 2 options. You get on that train or you spend an inordinate amount of time at the train station. And that's not what we are going to do. We are going to make this happen one way or another. Cost and quality, reform, narrow networks. I met a gentleman in the lobby who started sharing some thoughts about that. These conversations take place every day. The health plans and the docs and the hospital don't always see eye to eye on all these things, but we have to. We have to find a way for that to happen. And the future is working on how do we get to value, because value is all that matters. So great companies reject the choice between consistency and change. They embrace consistency and change at the same time. We have to do it. It's not optional, and we're going to do it. And I see a lot of the young faces of students in this room, and it gives me an inordinate amount of hope. I've had the pleasure of meeting many of you. My wife does request that you do something to make sure she and I get a bed if there's a shortage later, but we're going to need all the help we can possibly get. So now the fun part of the evening for me. I want to introduce 3 people who are not just colleagues, but are dear, dear friends, or people who I have called up for literally most of the last 27 years to seek advice from. The reason I wanted to be the moderator and not the panelist is because these people know a lot more than I do, and I thought there was more for all of you to gain from. So if I may start with one of my oldest friends, Dr. John Ginrett from Sharp Reese Steely. He's the CEO of their medical group. It is very large. John, if you wouldn't mind coming up. Go ahead.